Hello, I'm John Williamson. Clearing my throat. Hello, I'm John Williamson, your clinical trainer today. In the previous clip, I gave a little introduction to bodies in crisis when the crisis is in the airway. So we have already, in a much previous clip, so two previous clips before, we have looked at top to toe. We began the top to toe assessment of a person whose body is in crisis, who is going through symptoms of illness. And we began with the head, and in the head, we want to make sure that there's no head injury. And we discussed that, how to just from a layman's point of view, perspective, just look at the obvious and let the obvious lead you to the not so obvious. So I talked about looking at things like skin color, inflammation of the skin. I may not have mentioned that location of pain. So if somebody says that they've got headache, they've got migraine, so that is something which could be an indicator that there is something beyond the obvious. It could be an indicator of head injury. It could be an indicator that they have something which is a problem in their cardiovascular system. So sometimes variations in the pressure, either hypertensive, if somebody is feeling pressure in the blood circulation, whereby they are feeling a lot of stress and tension. Sometimes it can present as headache. All sorts of things. Eyesight, poor eyesight. Sometimes when the eye is straining to focus, that could also lead to headache. But most of all, we are very much aware that we want to rule out the danger of head injury, and we never can be sure through the obvious. So what we will do is we give them first aid. We make sure that they are actually able to breathe, to make sure that they are not in any danger in terms of loss of consciousness, and then we make sure they are stabilized by the time assistance arrived in terms of the emergency paramedics to take them to the hospital. And in all cases, they need to be examined clinically. They need to be examined in a clinical environment. They need to be examined by a clinical person, even if the symptoms leave. So with that background, I just want to say something a bit more about assessing the airway. Now, I mentioned in the previous clip that when you are about to assess somebody, i.e. their airway, one of the first things you want to make sure is you do that quickly, because you've got about 3 to 4 minutes within which, if they are really obstructed, if their airway is obstructed, then they could develop a respiratory arrest. That means they stop breathing, and that could lead to other complications and fatality, which is death. So right now we have an example here. I've got a patient here who I want to assess for his airway, just to make sure that his airway, he's breathing okay, that the airway is not obstructed. So here I am now with this person, and I am arriving on the scene, and the first thing I have done is I have checked to make sure that there is no danger in the environment. Okay, there's no danger in the environment. So as I'm approaching the environment, I have checked to make sure there is no danger. So the next thing I want to do, and I want to make sure you can see me as well as to see what I am doing here. So as I am approaching, I make sure as well that this person is breathing. So the way I do that, I look for the obvious. So I approach this person, I lean over, presumably that they are on the floor, but I have to make sure I'm in a comfortable position enough to be able to quickly assess whether I can see them upward and downward movement of their chest. So to make sure that they are breathing, and I see that by looking. What can I see? The chest movement, the movement of up and down. So I am looking, and simultaneously as I am looking, I am listening. Okay, with my ears. I'm not going to have an earphone on, so definitely have my ears, and I'm able to listen. So I am listening. I'm looking, I'm listening, and I'm feeling. So what am I listening for? I'm listening for their breath sound, the breath sounds. I am looking for the chest movement, and I can feel it. Okay, I can feel it over my cheek. So this is a very quick assessment, and I have to do that within 10 seconds. I have to do that within 10 seconds. Now, if within 10 seconds there is no sign of the chest movement, there is no sign that they are having breath sounds, it's obvious that there is some things I need to rule out. So I want to find out, for example, is their airway obstructed? So the way I determine whether their airway is obstructed. Now, before I go through that, I was just going to do a chin tilt, chin lift, but I'm not going to do that now. I want you to engage in a simple exercise with me. And that exercise, I'll leave it for the next clip, because I realize we are over 7 minutes already, and I want to keep the clips as short as possible. So when we come back, I'm going to go through another stage of assessing the airway, but I wanted you to, participate in a little exercise just to know what it could feel like for somebody who is very weak, semi-conscious, probably unconscious, maintaining their airway. So when we come back, see you soon.